If Congress does not extend the Affordable Care Act subsidies by the end of December, about half of the 500,000 Pennsylvanians who use Penny, the ACA marketplace for PA, could see their monthly premiums rise so much that they will forego coverage or accept a limited health care plan. That's according to the Pennsylvania Health Access Network.
Now, two Republicans in our state, U.S. Senator Dave McCormick and Congressman Brian Fitzpatrick, have reportedly voiced support for extending those subsidies. This is the issue that was central to the divide in October's government shutdown. With a little more than 3 weeks until the deadline, there is no viable congressional plan to extend the tax credits today.
And if they don't, millions of Americans will see their health insurance premiums go up. That's according to KFF, an independent health information nonprofit.
Now, for some, those monthly costs are about to double, triple, or more. Tonight, what that means for one Pittsburgh area businesswoman. I'll let Tori Baggett, the owner and sole employee of Supermut Press, tell you what her company does.
Supermut Press is a very small letterpress printing company that I'm just getting up and running. It's my first solo adventure, and I mostly do wedding invitations, greeting cards, wall prints, custom packaging, anything that can be letterpress printed.
And she does it all with a hypermobility spectrum disorder, a chronic condition called Ehlers-Danlos syndrome, something now well managed after years of working with a UPMC team of doctors.
Just pain, just widespread pain is the biggest issue that I have, which obviously makes it hard to do the job that I have, working with my hands and standing all day and, lifting things. I've been able to basically be healthier than I've been in a while with this team.
3 years ago, Tori first enrolled in coverage using Penny, the Affordable Care Act marketplace in Pennsylvania. Her Penny representative warned her.
Like last year, they were like, coverage might go up. And, hearing the political rhetoric that's been going on, it's, you hear about the ACA tax credit. So I've known about it for a little bit, but the reality of it really set in about a month ago.
That's when she saw the real amount of what she will pay in premiums go from $197 a month to $365 a month.
So I was on the phone actually with my coverage specialist, and she was like, I'm gonna brace you for this. She sort of built it up. She's like, we're gonna look at it. It's not great. And I said, okay. So I clicked through and I was like, that is not great.
Many will not be able to afford health care at all anymore. So when we talk about the level of crisis, it's terrifying.
I asked Tori's representative in Congress, Democrat Summer Lee, about how the U.S. government can pay for extending ACA subsidies, something Tori Baggett just testified about during a recent hearing.
How do we make the financials work in Washington?
Yeah, I don't know that and I didn't realize that there was a narrative that the financials didn't work, right? We make investments based on the things and the people who we care to help. If investing in the health of our nation isn't one of the top priorities, then I think that is a financially ruinous policy stance to take. This has saved thousands of Americans in healthcare costs.
Representative Lee says extending the ACA tax credits isn't a Republican or Democratic issue.
When you couple the reconciliation package back in January, that was the largest cut to Medicaid in history. And that was for tax breaks for the wealthy. And then when you couple them with allowing, if the Republicans allow the ACA subsidies to expire, they let those tax credits expire, this is just going to be another burden on top of a burden.
Well, I did reach out to Senator McCormick and Congressman Fitzpatrick for this story. I will let you know when I hear back from them. Democrats in the Senate plan to vote on a bill to extend the tax credits on Thursday. It is not projected to pass. Tomorrow, I will introduce you to a local man who just retired. The marketplace calculated that his monthly premiums will rise tenfold if Congress does not act.